Hello, my name is Cody Jones, and I'm taking this speech class, and I'm taking this opportunity to talk to you guys about patient bedside communication. For the past 4 years, I've been working at two different hospitals, and one is in the small rural town, Rolla, Missouri, and now I work at one in St. Luke's Hospital. I do things like help nurses take out IVs, I do blood draws for labs, EKG tech specialists, and other CNA duties. My specific goal I want to talk about is to not only inform the audience on how really hospital communication works, but to point out the obvious flaws that are in place even today that are on both sides of fault, whether it's patient ignorance or nurse ignorance, pointing them out and then having some sort of resolution on how we can overcome them. Having any family member in a hospital setting would want to rest easy knowing that he or she is being taken care of, and that includes listening and talking to the patient. More studies have shown that patients care more about being listened to than the quality of care from a doctor when shopping around for doctors. So to divide up what we're talking about here, I'm going to talk about two things. One is med-surg floor, which is all in-housing nursing floors inside of a hospital, and then that's divided by intensive care, which is very, in layman's terms, very serious health decline, the ICU, intensive care unit. So Elizabeth Jenkins submitted an article about a couple years ago. I got it from EBSCOhost at eastcentral.com. She submitted a questionnaire to a hospital who asked patients how they feel about asking about medications and things like that. Often patients feel like they have no sort of control over what's going on during their hospital stay, that they kind of leave it up to fate, whereas nurses are trained to make the patient not feel like that, so it's kind of contradicting each other. She said this article gives multiple options to be proactive and is best to the patient's ability in a hospital setting, like asking questions and letting the reader know that ultimately a hospital is on their side. I find this article to be really imperative because if a nurse walks in with Protonix and shoves pills in the patient's face, they can be really scared, and the way to overcome that is, as Elizabeth says in this article, is to educate the patient that you're within your own right to ask your own questions. If you usually don't take medication at home, ask your nurse to what is all of this about even. And what this article is basically saying from Elizabeth is that even on a med-surg floor, like a long-term facility, nurses are more than happy to answer questions, and it does not bother them whatsoever. On the other side, on the intensive care unit side, like I said, on med-surg, patients are usually awake and talking and giving feedback. And I was giving examples on how patients, and Elizabeth was also giving examples on how that you can communicate better with your nurse. However, in the ICU, patients don't even get that option at all. They're often unconscious, especially with COVID-19 going on today. I've seen many patients who have been unconscious for weeks. They have what's called a endotracheal tube, so that goes down your trachea and down your throat and into your diaphragm that pumps air into it for you. Their eyes are taped shut. So the only way of communication is through hand squeezing, and that's what Yu, registered nurse in New York, who's the leader of the ICU in one of the hospitals in New York City. She says that that's how nurses in the ICU communicate with patients who are nonverbal or from a different culture. They use hand squeeze. They ask them a direct verbal question because they can hear them. They say reply with a hand squeeze or blink or twitch your face, anything like that. It's just different, trying to overcome that speech barrier, and that's how nurses are able to overcome that. And sometimes new nurses who float up there, floating as a term of like moving for the night if they're short-staffed, nurses who aren't familiar with that need to be well accommodated for that. And the point I like the most is that Elizabeth Jenkins, from the source from the med-surg floor, and Yu Jang, the nurse from New York City in the intensive care unit, both of their direct quotes, Elizabeth's direct quote is, "Also educate that sometimes having visitors on med-surg long-term floors can be more of a hindrance than a guidance. Visitors do not necessarily know what happens at a hospital to accurately criticize nurses. that is sometimes true, not all the time is true, but most of the time, overbearing visitors can be a problem. And Hayu Jang agrees with that, although they didn't work together, but their direct quotes align perfectly and help each other in this argument. And Hayu Jang from the New York City says, more emotions run high when a patient is considering the acute decline of their health. So acute decline basically means direct downward spiral, which that ICU. So she says it's a direct acute decline of their health. It is important to be able to properly communicate to the patient and their visitors who also have an emotional spike, given the context of the circumstances. I find these sources to be imperative to understanding patient bedside manners. It's important to give the most power to the patients in the obvious and simple way possible. You want to make them feel at home. Instead of going inside of their room with something, you knock on the door first. It's little things like that that may seem very simple and obvious to nurses and workers like myself, but it's a life-changing thing for a patient. In the real world, we are all human. Nurses are imperfect. I need to get this out there to give insight to healthcare workers who are currently battling, the frontline workers at COVID-19, and also to the patients who will be admitted to the hospital. It's only a matter of time. Through proper education, the nurse and to the patient, coupled with self-awareness that I think we can all work on, we can eliminate any negative factors in communicating to any patient with disabilities or from any culture, and eliminate any speech disabilities. As we discussed, there are many factors to consider when communicating with patients. Type of treatment, culture, and the type of visitors all play an important role. Whether it's intensive care or long-term care, with visitors or without, it's imperative that we do not discourage bedside communication with the patient, because the only person that's losing in this situation is the patient. Thank you.